الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Murine typhus due to Rickettsia typhi by Professor Mahmoud Hani Sulaiman. Microbiology. Murine typhus is caused by Rickettsia typhi, which is an obligatory intracellular gram-negative bacterium organism infects endothelial cells in mammalian hosts and midgut epithelial cells in flea hosts. Epidemiology. Murine typhus distributed worldwide, prevalent in tropical and subtropical seaboard regions where rattus species and their fleas Xenopsilla chiopis serve as reservoir and vectors, respectively. In US, most cases reported in southern Texas, southern California, where cat flea, again cat flea is predominant vector and opsomas are suspected reservoir. Disease transmitted by inoculation of infected flea feces into a flea bite wound. The incubation period is 1 to 2 weeks. This is the transmission of murine typhus. In urban transmission cycle, Xenopsilla chiopis and rattus species. In suburban transmission, kitten Felis felis is responsible and opsomas is suspected. This picture shows Norway rat, Rattus norvegicus, in a corn storage bin. Rattus is known to be a reservoir of bubonic plague transmitted to people by bite of a flea or other insect. Endemic typhus fever, rat bite fever, and few other dreaded diseases. Plague, endemic typhus fever, and rat bite fever and other diseases. Clinical manifestations. Frequent symptoms in early illness include fever, headache, nausea, and vomiting. Rash occurs in about half of patients. It is macular or maculopapular and is mostly observed on trunk. Clinical course is usually uncomplicated, but occasionally CNS abnormalities, renal insufficiency, respiratory failure, and death occur. Increased serum hepatic aminotransferase are frequent lab findings. Vascular injury will lead to hypoproteinemia, hypoalbuminemia, and electrolyte abnormalities, e.g. hyponatremia and hypocalcemia. This photo shows petechial rash of murine typhus. Diagnosis. Early diagnosis of typhus is based on clinical suspicion and epidemiology. Immunofluorescence assay is the mainstay of serologic diagnosis, which is generally retrospective. A fourfold rise in immunoglobulin G titer from acute illness to convalescent confirms diagnosis. Immunohistochemical detection of Rickettsia typhi in a skin biopsy specimen can establish diagnosis during acute infection. PCR of rickettsial nucleic acid in blood or skin biopsy samples can also establish diagnosis, but sensitivity is poor on blood. To avoid prolonged illness and severe potentially fatal infection, treatment should not be withheld while waiting laboratory confirmation. Treatment and prevention. Doxycycline 100 mg twice daily for 7 to 10 days, preferable 10, is the treatment of choice. Prevention is directed toward control of flea vectors and potential flea hosts. This is the slide for rat control again. Please print it, study it, and use it. Principal treatment regimen for murine typhus: either doxycycline chloramphenicol, and ciprofloxacin. Doxycycline, chloramphenicol, and ciprofloxacin. Please print and use this table. Summary. Synonymous: flea-borne typhus, endemic typhus. يبقى other names: flea-borne typhus, endemic typhus. Epidemiology: worldwide distribution, incidence affected by rat and flea population and climate. Main pathogenic mechanism: systemic inflammatory vasculitis. Common clinical characteristics: fever, headache, and rash. Fever, headache, and rash. Common lab abnormalities: liver enzyme elevation, hypoalbuminemia. Disease outcome: usually favorable, low rate of complications and mortality. Treatment: doxycycline, chloramphenicol. Prevention: rodent control programs. والحمد لله رب العالمين. Thank you for your good listening.